Hey everybody, Dr. Patel here. Welcome to this week's Facebook Live. Over the course of the last couple of weeks, we've been talking about the knee. And we started off talking about knee anatomy. We talked about ACL tears. We talked about osteoarthritis or degeneration of the knee joint. And today we're going to be talking about one of the most common things that is used to treat severe knee osteoarthritis, and that is knee replacement surgery. The truth is that knee replacement surgery is absolutely necessary in several types of particular situations, but it can be avoided many times, and there's a lot of things that can be done to avoid knee replacement surgery. So today I'm going to be talking a little bit about the surgery itself, number one. Number two, I'm going to be talking about situations when it's necessary, situations when it's not necessary, and then I'm going to talk about the three things that I would recommend for a patient of mine in order to avoid knee replacement altogether. So first of all, what is knee replacement surgery and what is it beneficial for? So, we talked previously about knee osteoarthritis, and osteoarthritis meaning degeneration or wear and tear of the knee joint. I'm going to briefly just go through some of the anatomy again and explain what happens when we have knee arthritis occur. And then I'll be able to explain a little bit more in depth as to, why is it that knee replacement should be necessary. So just briefly going through the anatomy here, the knee joint is where the thigh bone meets the lower leg bones. Right, if we're looking straight at the knee, this is the right knee, so this is the right side of the right knee, this is the left side, this is the femur or thigh bone, this is the tibia and its partner, the fibula. We have these shock absorbers in between those bones called the meniscus, shock absorber on either side. These are actually these ring-shaped shock absorbers. When you look at it from top down or bottom up, they look like this. And then we have ligament structures that are connecting the bones together. We have your LCL or lateral collateral ligament, your MCL, your medial collateral ligament, your ACL in the middle, and the PCL behind it. Okay, and then we have the smooth surface of the bone called the cartilage, right? And that cartilage is the smooth surface that allows for nice smooth movement. As we get older in general, our knees start to put pressure in various different areas. Typically, there's more pressure that's being placed on the inside of the knee, and the knees start to bow outwards. So what that ultimately looks like is that our knee starts to bow outwards like so, and we end up putting more pressure on the inside of the knee. As more pressure is placed on the inside of the knee, then the meniscus over here gets degenerated and starts to get less shock absorbing. Then there's more friction that's placed on the cartilage. The cartilage starts to wear away. Eventually the bone underneath the cartilage starts to get rougher. Eventually the bone starts to get a bruised appearance. Eventually the bone starts to break down, and eventually the bone dies. And that's the full spectrum of what's called osteoarthritis. Now, I mentioned this before, with the exception of when the bone is actually dying, the remainder of the spectrum of osteoarthritis does not necessarily equal pain. And if we can get the body moving correctly, then oftentimes we're able to avoid that knee getting irritated or getting inflamed or getting painful. But there are circumstances that knee replacement is absolutely necessary. Knee replacement, ultimately what it does is that knee replacement removes a piece of the bone from here and removes a piece of the bone from here and replaces these two parts with hardware that then interfaces with each other and is no longer reliant on the smooth cartilage or the meniscus shock absorbers, and that ultimately is removing some of this bone to put this new piece into place. And it sounds great, right? It sounds fantastic to actually remove that bone that may be degenerating or dying back. And in some circumstances, like I said, some circumstances that could actually be really beneficial. So what are those circumstances? Well, I tell my patients that if your pain is constantly or more often than not greater than a 5 out of 10, 0 being no pain, 10 being pain is so severe that you need to be rushed to the hospital, right? If your pain is generally more often than not more than a 5 out of 10, if the pain is getting in the way of your function, of your ability to walk appropriately, if you're starting to get more and more deformity, right? If the bone is actually starting to bow outwards to such an extent that you can't walk straight anymore, right? The bone is bowing outwards substantially. And especially if we have tried conservative treatments and we're not getting the results that we want, well, those are circumstances where we may want to get a knee replacement, right? Why do I say these specific things? I'm going to go into it more in depth, but in general, I say you want to have pain more than a 5 out of 10 because there's some research that shows up to 40% of patients after knee replacement surgery. Some studies say a third of patients, one study at least said up to 40% of patients continue to have pain after knee replacement surgery. And what's more substantial is for those patients that have pain, the average pain level after knee replacement surgery is about a 4 out of 10. So if you're sitting at a 3 out of 10 or a 2 out of 10, generally speaking, in terms of your knee pain, then, well, you may want to think twice about getting a knee replacement if there is a legitimate risk that your pain may be worse after the fact. I mentioned function because even if your pain is a 3 out of 10, generally speaking, but because of deformity, because of your decreased range of motion, because of the pain, you're unable to walk appropriately, well then that may be a situation where we're leaning more towards a surgical procedure. And the deformity itself plays a factor, right? Because if you're starting to bow outwards or get severely knock-kneed, or if you're having such bony changes or bone spurs that are occurring that are not letting you straighten out your knee completely or not letting you bend your knee in a position that's allowing for appropriate walking, appropriate, going up or down stairs or anything along those lines, well then those are circumstances where the knee arthritis is getting so severe that your function is being limited, then all right, maybe that's a circumstance where a knee replacement may be the right way to go. But the reality is that knee replacement surgery is, quite frankly, offered much more frequently than we would like. How do I know this? Well, there was a study in, I believe, 2017 in the British Medical Journal that showed that up to 1 out of 5 patients after knee replacement surgery were actually dissatisfied with their results, dissatisfied with their outcomes. That surgery showed that 1/3 of patients had continued chronic pain after their surgeries, and the suggestion was made that 1/3 of patients were never appropriate to have surgery in the first place. Meanwhile, there was a report, I believe in 2018, that said that the trajectory or growth of bone marrow, knee replacement surgeries was actually tremendously increasing, and the projected volume of surgeries by the year 2030 was something like 1.28 million procedures, and by 2060 we were expected to reach 2.6 million primary knee replacements per year. So really, really crazy numbers of knee replacement surgeries when we think about it, and especially when we think about the potential that 1/3 of those numbers are not appropriate whatsoever. So what do I mean by not appropriate? When is it that we should try to avoid knee replacement surgery? Well, I do second opinions across the country. I consult for a telemedicine company called Second MD, where we talk to patients across the country that are either lost in terms of the type of treatments that they're receiving, want another opinion as to what their appropriate care should be, or are scheduled or are have been suggested to have surgery, and they want to know if that's the right decision. And I can't tell you how many patients that I've spoken to. I can't tell you how many patients that I've spoken to that were scheduled for a knee replacement, who had never had any conservative treatment prior to the fact, who were not even examined by their physician. They were just shown an x-ray that showed some arthritis, and they were said, all right, your only choice is a knee replacement surgery. Some of these patients may have received a handout to do some exercises, and when those exercises failed, well, all right, next choice is knee replacement. Or they were told to get a cortisone injection. Cortisone injections calm down the pain or inflammation, but only really last for a short period of time. And then repetitive cortisone injections actually make arthritis worse, right? So they go to a surgeon and they're told, all right, let's do these cortisone injections every few months, and then when they stop working because the arthritis is worsened, well, all right, next step is a knee replacement surgery. So this is a big issue. This is a big issue because a lot of times when I'm giving these second opinions, I'm like, wait, let's pump the brakes here for a second and take a step back and ask the questions that I was asking before, right? Is your pain constantly over a 5 out of 10? Are you having a decrease in function? And are you having significant deformity of the knee? How bad is the arthritis really? Because, I've seen patients with just moderate knee osteoarthritis that were suggested to have knee replacement. So in the absence of those things, the category of patient that I just mentioned that I think knee replacement may actually be appropriate for, outside of that small patient population, I think there's a lot of things that can be done. So I'm going to go through my 3 keys to trying to avoid knee replacement. And these are broad categories because there's a lot of different nuances and a lot of different things that could really be done in each of these type of categories. But taking a step back and looking broadly at what knee arthritis is, and what are all the different options that are available, we have to look at hitting things from all angles. So the 3 main things that I like to discuss is, number 1, I mentioned before in the previous videos and earlier that knee arthritis does not have to equal pain. If we are moving correctly, then the knee that has arthritis does not necessarily have to get aggravated. A joint that has knee arthritis, that it's easier for it to get aggravated, it's easier for it to stay aggravated, but how do we prevent it from getting aggravated in the first place? And that's figuring out how to move correctly. So the number 1 thing that I typically recommend for my patients that have knee osteoarthritis and are trying to avoid knee replacement is physical therapy. When I say physical therapy, I don't mean massage, I don't mean manual therapy or chiropractic or osteopathic manipulation. I don't mean heat or electrical stimulation. I don't even mean like just gentle stretching or movement of the knee. When I say physical therapy, I mean guided, specific exercises, particularly to strengthen the muscles around the knee, and not only around the knee, but the muscles of the ankle and foot, as well as the muscles of the buttock, hip, and low back. This is super important because, as I mentioned, if we're moving correctly, then we don't necessarily have to irritate the knee arthritis, right? So strengthening the muscles, the purpose of this, the purpose of the physical therapy is not to get rid of the pain. The purpose is to get the body moving correctly. Pleasant side effect of that is that the pain could get reduced, but the purpose is to get the body moving correctly. And in doing so, if we can get the body moving correctly, if we could strengthen our muscles correctly, then when we are taking every step, when we're going up and down stairs, when we're getting up from a seated position, well, our muscles will be stronger and we won't be putting abnormal pressure into the joint. And therefore, the knee won't be getting irritated. So the number one key thing to avoid knee replacement surgery is the appropriate strengthening exercise that's guided by a physical therapist. Number one is what we do with our body. Number two is what we put into our body. So as research has gone on, we've come to realize that osteoarthritis, pain associated with osteoarthritis, sometimes has to do with the mechanical pressure of the bone itself. Sometimes has to do with the bone actually getting bruised and dying back. Sometimes it actually has to do with inflammation and the body's or that joint's inability to control or manage that inflammatory response. So I'll clarify that a little bit. What happens is inflammation is actually a good thing. Inflammation is actually the first part of healing when we get an injury or we get irritation to a joint. And I've said this before in previous lectures, if you know, when you're a kid and you twist your ankle and that ankle swells up, right, that's inflammation. That's all the blood coming to the area to clot off the injury, calling cells like macrophages to get rid of the damaged tissue, and calling your local stem cells to then navigate through the healing process. That's what inflammation is. Inflammation is a good thing, but inflammation should come and go. Well, a part of the reason why inflammation can have the tendency of sticking around is if our body is predisposed to inflammation. Believe it or not, there's certain foods that we can eat that actually causes inflammation to be up or down. There's not a lot of research on this, but there's a little bit of growing research that suggests that certain foods can actually cause a systemic inflammation throughout our body. This isn't the thing that's going to cause the arthritis, and this isn't the thing that's necessarily going to cause the pain, but this is something that can definitely add fuel to the fire. So I've had a lot of patients at this point that are like, yeah, my knee hurts, but I've noticed that it hurts worse when I'm drinking a six-pack over the weekend. Or it hurts worse when I'm eating ice cream, or it hurts worse when I'm having that 3 slices of pepperoni pizza, right? Because there's certain foods, particularly things like alcohol, particularly things like processed sugars, and even things in some patients like dairy and meats that can cause inflammation. Even certain vegetables in certain patients can cause inflammation to be increased within our body. So one of the main things that I recommend, and the second key step to avoiding knee replacement surgery, is really honing in on an anti-inflammatory diet. Focusing on the types of foods that help with blood flow, multicolored vegetables, decreasing sugars, decreasing processed meats. These are general statements, and working with a nutritionist can really be beneficial at tuning in on what is and is not inflammatory for you specifically. But our foods, our nourishment can play a factor in terms of inflammation and in terms of our body's ability to heal. So number 1 is what we do with our body. Number 2 is what we put into our body. Number 3 is the environment of the joint itself. So I mentioned before that inflammation, part of that inflammation that occurs when we get an injury is that the local stem cells come to the area to help navigate through the healing process. Now, the local stem cells that come to the area, they're in charge of saying, all right, hey, this is how we're supposed to heal, right? They're the foreman of the construction site, so to speak. And inflammation is like the demolition day of your home reconstruction. right? It's technically a negative process because it's getting rid of, but it's getting rid of the old kitchen cabinets or the damaged tissue in order to lay down the foundation for new. And it's the local stem cells that dictate how that process occurs. That's what happens when you're a kid and you twist your ankle, or you get a small injury and you have swelling occur. That injury eventually heals on its own because of the actions of the local environment. But when we have osteoarthritis, there's some evidence that shows that as we get older, the local stem cells, or what are called progenitor cells in the region, actually decrease, are less viable. And what happens essentially is, theoretically, the local stem cells that live inside of a knee that has osteoarthritis, well, those stem cells are just not working as appropriately. So the foremen of the construction site are not working the way that they should be. The cells that are in charge of navigating through the healing response, or causing and then getting rid of the inflammation, are not working properly. So that ultimately means that instead of that demolition day coming and going, instead of just taking off the kitchen cabinets, we get stuck in demolition day, right? So instead of taking off just the kitchen cabinets, now we're taking off the drywall too. And ultimately, that is why the inflammation with osteoarthritis can ultimately cause the osteoarthritis to progressively worsen. That's how we go from mild osteoarthritis and gradually, progressively worsen. Number one, because if we're not moving properly, we're constantly causing wear and tear. But number two, because if we're feeding our body inflammatory foods, we're predisposed to inflammation. But number three, also because the local environment is gradually working less efficiently. So that being said, the third key to helping prevent or avoid a knee replacement surgery is doing appropriate procedures to try to keep that joint as healthy as possible. When your knee arthritis is in that mild to moderate category, avoiding cortisone injections, right? Avoiding cortisone injections that'll just actually make the arthritis worse. There's research that shows that multiple cortisone injections inside of a knee will actually cause cartilage loss to worsen. So we want to avoid things like that. If it's really a mild condition, the hyaluronic acid or gel injections could be very appropriate at calming down some of the pain and still preserving some of the health of the joint. Hyaluronic acid injections have not been associated with a worsening of osteoarthritis. Prolotherapy or sugar water injections for milder conditions could be appropriate at actually waking up the environment inside the joint, right? Because sugar water, when injected, or what's called prolotherapy, that sugar water actually causes a little bit of irritation, tricks the body into thinking that it's a new injury that's there, and kind of kickstarts the healing process in that area. So for milder conditions, prolotherapy, sugar water injections could be very, very reasonable. When we go from mild to moderate categories, using a patient's own blood PRP or platelet-rich plasma. Platelets are the things that clot the blood when you cut yourself. Those platelets have growth factors that actually act as nutrition for the local environment. Those growth factors cause and then take away inflammation, and they actually help by providing nutrition to the local stem cells in the area. And when we get to more severe cases, using a patient's own bone marrow, or even potentially using a patient's own adipose fat tissue, could be beneficial at helping wake up that environment, helping improve the environment inside of a knee joint. In fact, we are starting to get more and more research that supports these biologic treatments for knee osteoarthritis conditions. For mild to moderate situations, we have over 30 randomized controlled trials looking at platelet-rich plasma, or PRP, in comparison to saline placebo, in comparison to hyaluronic acid gel injections, in comparison to corticosteroid injections. And by and large, these studies are showing that the PRP injections are not only beneficial, but have longer lasting benefit than things like corticosteroid injections. And For more severe situations, we're starting to get some more research on things like adipose fat tissue as well as bone marrow. This year, there was a great study published from one of the forefathers of regenerative medicine, a physician in France named Philippe Hernegue, who looked at 120 knees in 60 patients over 15 years. And these were patients that had bilateral knee osteoarthritis or severe arthritis in both of their knees. One knee ended up getting a knee replacement. The other knee had their own bone marrow cells injected directly into the bone of the knee. So directly into the area of the knee where we're getting issues, right? And that bone marrow was placed directly into both of those areas, and looking at data over the course of 15 years, approximately 60% of the patients were able to avoid knee replacement in their bone marrow stem cell knee. And the vast majority of patients preferred the stem cell knee more so than the knee replacement knee. So some pretty robust data looking at an extended period of time of patients treated with their own bone marrow stem cells, and we're recognizing that even in relatively severe knee osteoarthritis cases, we're able to avoid knee replacement if we are helping the local environment heal, and when we help the local environment get back to a healthy environment, right? The local stem cells with knee osteoarthritis are progressively worsening, and if we can use your own body's biologics to help that get healthier, then we can oftentimes avoid surgery. So I hope that all made sense. There's obviously a lot more detail to this all. There's a lot of nuances. There's a lot of specifics when it comes to really all three of those categories, but those are the three keys to avoiding knee replacement surgery. Number one, what do we do with our body, or how do we exercise, use physical therapy to strengthen the muscles, to get the body moving correctly. Number two, what do we put into our body? Our nutrition, anti-inflammatory foods to help the body fight inflammation and help the body heal. And number three, what do we do with our joints biology? And how can we help that knee joint prosper? How do we help prevent that knee joint from getting worse, rather than doing things to the knee joint that'll progressively make it worsen? So hope you guys found this helpful. If you did find this helpful, please like this video, share this video, share it with your friends, share it with your enemies. Ultimately, everybody deserves to walk on their own knees. Sometimes, like I said, knee replacement is absolutely necessary, but we can avoid it. And I hope that this was clear in showing you the ways that is possible. If you guys have any comments, questions, please feel free to comment, DM, or you can email us at info@fxregencenter.com. If you have any particular topics that you want me to discuss on future dates, definitely drop me a line. Otherwise, I hope you guys have a great long weekend. Happy Memorial Day, and I will see you guys next time.